Alright, I'm gonna hand hygiene for 20 seconds. Knock knock. Hi, my name is Sean. I'm gonna be your nurse for today. Can you please state your name and date of birth for me? Alright, Sarah Smith, born March 8th, 1988. Let me just check your wristband. Perfect. And do you have any allergies? No? Let me check your wristband again. Perfect. And your doctor has ordered a urinary catheter for you because you've been having some discomfort and trouble urinating. Is that correct? Yes. And have you had this procedure done before? Yes. I'll still just do a quick rundown of the procedure with you. So I'm going to lift up your gown to clean your genital area. Then I'm going to insert the urinary catheter into your urethra and then into your bladder. I'll then inflate a little balloon, and the little balloon will help keep the catheter in place in your bladder, allowing you to move around with it in place. We will then attach a catheter to your thigh so the Foley stays secure and in place. This Foley will help remove the urine and it will be collected in the collecting bag. Do you have any questions or concerns? Is the procedure painful? No, it shouldn't be painful, but you may feel a bit of discomfort when the catheter is inserted. Any other questions? No. And are you currently in any pain or discomfort right now? Some discomfort because of the urinary retention? Okay, I see. Just give me a second. I'm going to go ahead and set up my workspace and then we'll get to it, okay? So I'm going to go ahead and hand hygiene for 20 seconds. And then I'm going to go ahead and put on some gloves. Okay, so I'm going to go ahead and now wipe the table down for 30 seconds. Okay, just gonna clean up the sides here. Perfect. So I'm gonna go ahead and discard this. I'm gonna take my gloves off and I'm gonna perform hand hygiene for 20 seconds. I'm gonna let this table dry for 2 minutes and then I'm gonna go ahead and close the curtains for patient privacy. And for this procedure, the patient needs to lie flat, so I'm gonna go ahead and lay the head of the bed down. Okay, now that that's all done, the table has now dried for 2 minutes. I'm gonna go ahead and grab my supplies and put it on the table. So I have my kit here. My stat lock, alcohol wipes, and syringe, and I also have my other wipes and my hand sanitizer right here. Okay, so I'm gonna go ahead and hand hygiene for 20 seconds. Then I'm gonna go ahead and put on some gloves. And after I put these gloves on, I'm gonna go ahead and begin to clean the genital area. So I'm going to now remove the blanket. Okay, perfect. I'm gonna go ahead and put your legs into a froggy position, Mrs. Smith. Okay, and I'm also gonna put a cup in between your legs for this procedure. Okay, and for this procedure, I'm also gonna grab you a warm blanket just to keep you warm during the whole procedure. Okay. Perfect. So now I'm going to go ahead and begin cleaning. So I'm going to go ahead and lift up your gown. I'm going to go ahead and begin cleaning the area. So I'm going to do one swipe down the right side, discard. One swipe down the left side, discard. And I'm going to do one swipe down the middle. Okay, discard. I'm going to go ahead and discard this, and I don't need my gloves anymore, so I'm going to take those off and I'm going to hand hygiene for 20 seconds. Then I'm going to go ahead and put on some new gloves. Okay, and after I put on these new gloves, I'm going to go ahead and set up my kit. So I'm going to go ahead and open up my kit, take this out. So when I open my kit, I'm gonna make sure I'm only touching the 1-inch border. I go out, okay? And then for this one, I'm gonna open the sides up, and I'm also gonna rotate it just to make it easier to work with. I'm gonna do the last flap here. Perfect. So now I'm gonna go ahead and reach in and take out my sterile gloves. Okay, and next I'm going to grab out my sterile drape. So I'm going to grab it by the 1-inch border. I'm going to open it up And I'm gonna make sure that the shiny side is down and that I'm only touching the 1-inch border. Okay, so now I'm gonna go ahead and lay the drape down. Okay, perfect. So now I'm going to discard this. Okay, I'm gonna go ahead and drop my supplies in. So right here, drop that in. Drop my stat lock. Okay, perfect. Next I'm gonna drop in my alcohol wipe. Okay, perfect. Okay, so now I'm going to take off my gloves and I'm going to perform hand hygiene for 20 seconds. I'm gonna go ahead and now set up my sterile gloves. So I'm gonna open this up and I'm gonna make sure to open it by only touching the 1-inch border. Okay, so I'm gonna go ahead and put on my gloves. So I'm gonna grab my right glove. I'm gonna go ahead and put it on. Okay, now that that's on, I'm gonna go ahead and grab the left one. I'm gonna put it on. Okay. Perfect. Now that my sterile gloves are on, I'm gonna go ahead and reorganize my box. So I'm gonna grab this. I'm gonna put it in here. Okay. And now I'm gonna go ahead and turn the box to the side so that it's easier to work with. I'm gonna take the top off. So it's like that. Okay, and I'm just gonna transfer everything in. So my skin prep, stat lock, my syringe, my Q-tips, my lube, and also my syringe. Okay, now that that's all in, I'm gonna go ahead and toss this. Okay, so I have more room to work with. I'm gonna go ahead and turn this, and I'm gonna grab out my specimen cup. I'm gonna open the cap but leave it on so that I can take it out later. And then I'm gonna transfer my Q-tips here. I'm gonna go ahead and open up my lube and I'm going to drop this part here. I'm gonna unsheath my catheter. Okay, and after I unsheath my catheter, I'm gonna go ahead and put it into the lube. Okay, and now that it's in the lube, I'm gonna put it back into the box. I'm gonna go ahead and grab my syringe and I'm gonna connect it to the catheter. Okay, and now that I plugged it in, I'm gonna go ahead and put it back into the box. Okay, so seems everything is good to go. I'm gonna go ahead and transfer it to the patient now. So I'm gonna pick it up and I'm gonna go ahead and put it down right here. Okay, perfect. So I'm gonna begin cleaning the area now. So I'm gonna take 2 fingers and I'm gonna spread the labia and then I'm gonna go ahead and clean it. So I'm gonna do 1 swipe down the middle, discard. Second swipe is gonna be down the right side, discard. And last one is gonna be down the left side, discard. Okay, I'm gonna go ahead and discard this. And now I'm gonna go ahead and take out the catheter from the lube. And I'm gonna have you take a deep breath in. And then when I count to 3, go ahead and take a deep breath out, okay? Deep breath in, 1, 2, 3, deep breath out, okay? And I'm gonna keep going until I see urine flashback. And I see you're in flashback, so I'm gonna go 2 more inches. 1, 2. Okay. And now while my hand is still on here, I'm gonna grab my left hand. I'm gonna go ahead and inflate the balloon. Okay, now that the balloon's inflated, I'm gonna go ahead and take this off. I'm gonna discard this, and I'm gonna go ahead and tug on it a bit just to make sure it's secure. And it is secure, okay? So the catheter is now inserted. I'm gonna go ahead and put your gown back over, cover you up a bit. Okay, so how did that feel, Mrs. Smith? You in any pain? No? Perfect. So now I'm gonna begin taking out the urine. So I'm going to pinch the alcohol wipe. I'm going to swab the hub for 15 seconds. 1,000, 2, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 8, 1,000, 9, 1,000, 10, 1,000, 11, 12, 1,000, 13, 1,000, 14, 1,000. Okay, now that the hub is scrubbed, I'm going to go ahead and discard that. I'm going to grab out my syringe and I'm going to screw it on. Okay, and for the sample collection, I'm going to take out 10 cc's of urine. Okay, 10 cc's extracted, so I'm going to go ahead and twist it off. Now I'm going to go ahead and come over to the cup and I'm going to take the lid off and I'm going to put it in the cup, making sure to go slow so that I don't splash anywhere. And I'm also making sure not to touch the sides of the cup while I'm doing this because that will break sterile. Now that the syringe is all good, I'm going to go ahead and cap it. I'm going to discard this syringe and I'm going to go ahead and document the patient's name, the time, the date, and the patient's MRI number on here. Okay, I'm going to put this here to take to the lab in a bit. So now I'm going to go ahead and do the skin prep on the patient's thigh. So I'm going to grab this skin prep. I'm going to prep this patient's thigh to put the stat lock on. Okay. Now I'm going to clip this on. Okay. Now that it's clipped on, I'm going to go ahead and attach it to the patient's thigh. Okay, I'm going to go ahead and put this Foley bag on the side of the bed so that it's under the patient's bladder. And we want this so that the urine or the gravity will take the urine out. So I'm clipped it to the side of the bed, so we're all good with that. And then, yeah, so that completes the procedure. I'm going to go ahead and clean everything up. We'll need this. I'm going to take this out and I'm going to go ahead and clear this as well. I'm going to cover the patient back up. Okay, I'm going to grab this blanket back, put it to the side. Okay, perfect. So, that completes the procedure. How do you feel, Mrs. Smith? Good. I'm going to hand hygiene for 20 seconds. So I'm going to set the patient up, and then I'm going to put the bed in the lowest setting. I'll put your call bell right here. So now I'm going to take the urine sample to the lab. Use a call out if you need anything. I will be back to assess you. So when I step out, I'm going to go ahead and document the date, time, tolerance to the procedure, catheter size, color, amount of urine, and any additional characteristics, okay? Did you need anything else, Mrs. Smith? No? Perfect. So I'm going to go ahead and grab this urine sample and take it to the lab, and I'm also going to hand hygiene for 20 seconds. Okay. All right, I'm going to hand hygiene for 20 seconds. Knock, knock. Hi, my name is Sean. I'm going to be your nurse for today. Can you please state your name and date of birth? All right, Sarah Smith, born March 8th, 1988. Let me just check that on your wristband. All right, perfect. And do you have any allergies? No? All right, let me check the wristband again. All right, perfect. So your doctor just ordered for your Foley catheter to be removed. Have you had this done before? You have? Let me just give you a quick overview again. It's a really quick procedure. I'm gonna remove the stabilizer on the side of your thigh. Then I'll have you take a deep breath in. I'll count to 3 and you'll blow out in a big exhale. There, I'll go ahead and remove the catheter. You may feel a little bit of a burning sensation when I remove the catheter, but it's completely normal if you do. Do you have any questions or concerns? No? Okay. And I'm just gonna quickly assess the patient. And for my assessment, my patient is showing no signs of distress and is in a stable condition. So now I'm gonna perform hand hygiene for 20 seconds and put on some clean gloves. Alright, now I'm going to bring the supplies over. So I have my chuck, my syringe, and my alcohol pad. Alright, so I'm going to begin by removing the blanket. And I'm going to lift up your gown. And I'm going to go ahead and put your legs in a froggy position. Okay, and next I'm going to put my chuck under. Okay, and next I'm going to take off the stabilizer. I'm going to use this alcohol prep pad to get rid of any of the adhesive that's on there. And then now I can take this off and I'm going to unclip it. Okay, perfect. So next I'm going to grab my syringe and I'm going to remove the saline from the balloon. Alright, I'm going to discard that. Okay, so now I'm going to start the removal. So I'm going to have you take a deep breath in, and when I count to 3, I want you to exhale, alright? So on the count of, so go ahead and take a deep breath in. Alright, 1, 2, 3, breathe out. Alright, perfect. Okay, so I'm going to wrap this up in the chuck. And then I'm going to grab the Foley bag from the side of the bed. So now that I have this, I'm going to take the Foley bag and bring it to the bathroom to measure the urine in a graduated cylinder. I'm going to assess the characteristics, the color, the smell, and if there's any sediments. And then I'm going to discard it in the proper receptacle. Go ahead. Alright, and then I'm going to take off my gloves and perform hand hygiene for 20 seconds. And then I'm going to put on some gloves. Again. Alright, I'm going to reposition my patient. So I'm going to put my patient's leg back in a straight position. I'm going to cover them up again. Alright, and how are you feeling, Mrs. Smith? Good? Alright, perfect. So I'm going to reposition the patient's bed. Make sure you're feeling comfortable. You're feeling comfortable in that position? Yeah? Okay, so for the first 1 to 2 times after you urinate, I want you to call me in so that I can take a look at the amount of urine you have and the characteristics. You may feel a burning sensation when you urinate for the next few times, but that's completely normal if you do. It should go away as you urinate more frequently. If there is still pain that isn't going away, or if you're unable to urinate or experience bleeding when you urinate, please let me know so I can notify your doctor. Do you have any questions or concerns? No? Okay, perfect. I'm gonna take off my gloves, perform hand hygiene, and then is there anything else you needed before I left the room? No? I'm gonna place your call light right here, and then when I leave the room, I'm gonna document the date, time, patient tolerance, the next 1 to 2 times the patient voids, the urine color, the amount, and the characteristics. Alright, and I'll let you get to it.